2 days ago, Tony Abbott and Peter Dutton, the Prime Minister, and the so-called Health Minister stood in front of Canberra media and attempted to breathe new life into their GP co-payment. It will have the exact same negative impact of the original co-pay. Nothing has changed.
What we have is a Prime Minister in Canberra who thinks that with a change of language he can scrape off the barnacle that's stuck to the ship of the Liberal government. And the one thing we know about Tony Abbott, he hates Medicare, he hates looking after the vulnerable, and he'll do everything he can to stick a knife into the public health system of our nation and in this state.
Why, Mr Abbott, do you force general practitioners into a position where they have to have a conversation with their patients, not about what's wrong with them, but about what the size of their bank balance is? That reason cannot be that Medicare is unaffordable. It cannot be so, because our system of public health care is one of the most effective and one of the cheapest in the world.
We need to be very clear that this is not about budget repair. Whether it's $7 or $5, this is not about the budget, and this is not about some need to repair the budget in Australia. What this is about is a sneaky, single-minded, arrogant attack on our universal health system.
Now the campaign gets harder, because now the government's become more devious. It's trying to shift the whole discussion about a co-payment, as you've heard, away from the political realm to the realm of that between the patient and their doctor, which is appalling.
We stand for a universal access healthcare system where people get care at the right entry point to the health system, and that they get that care without it mattering how much they've got in their hip pocket. If they need the care, they get the care. That is what makes Australian health system one of the best in the world, and we want to maintain it that way.